Well, I introduced everybody else, so I can't remember if I introduced myself, but I'm Ruth Kraut. I'm a program manager at the Washtenaw Health Plan. My coworker, Kristen Nordberg, who just stepped out, will also be talking about enrollment and outreach. And we're also this afternoon going to have presentations from two staff people at U of M and St. Joe's who are going to talk specifically about what their plans are at U of M and at St. Joe's, because I know most of you have contact with one or both health systems and you're going to want to know who to go to. Okay, now, I know this morning we went through the timelines. We went through them kind of fast. I'm going to go through them in a fairly detailed way, okay? October 1st, the marketplace opens and the plans will be revealed. And I am not recommending that anybody get online with any clients on October 1st, okay? Take a few days for yourself to learn about the plans, because we don't have any advance information. I can't tell you what they're going to cost. I could tell you what the Kaiser subsidy calculator did, and Philip did a nice job of that this morning, but we don't actually know the cost. We don't know what the plans will look like. You'll be a much more educated person and much more able to help people if you take a few days for yourself and reduce the chances that the system will just crash. And Krista and I really want to explain what is happening with the Washtenaw Health Plan, because there is some misinformation out there. And because right now we do have almost, between Plan A and Plan B, almost 8,000 people on the health plan. Okay, so first of all, it looks like Plan A people they'll just stay on Plan A until Medicaid opens in April. And when Medicaid opens, we believe that they will just be shifted onto Medicaid. So if you're working with Washtenaw Health Plan, Plan A people, your job is to help them stay on Plan A, if you can. Which basically means, if they move, update their address, keep track of their phone numbers, that kind of thing. However, it is true that in the next 15 days, Washtenaw Health Plan, Plan B members are going to get a letter. And that letter is going to say that all Plan B members now have end dates of December 31st, 2013. And we have to do that because we have to be able to assess the eligibility of every person who is currently in Plan B for the exchanges, for the Medicaid expansion. But let's say that somebody is very low income and they are not going to be eligible for the exchanges, right? Because we're going to extend their eligibility until the date when we believe that Medicaid will be open, which we think will be April 1st, but we don't have absolute confirmation of that. If the person, for whatever reason, is not going to be eligible on the exchanges, they will be able to be renewed on the health plan. If they're not going to be eligible for the exchanges or for the Medicaid expansion, they'll be able to be renewed on the health plan. If there are issues with, we'll go into this, but basically, if you enroll in the first half of a month, all the enrollment's prospective. If you enroll in the first half of the month, say December 1st to 15th, you'll be enrolled effective January 1st. But if you didn't get around to doing this till December 20th, your enrollment won't start until February 1st. So we're gonna be flexible about those kind of things. Our goal, though, from the health plan's point of view, is to mesh the coverages. So one ends and one begins. And to the extent possible, we want every person who's on the health plan who is eligible either for Medicaid expansion or for the exchanges to get on that. And that's why people are getting this letter. It's coming in English and Spanish. I'm sure you'll get some panicked calls, but that's why we want you to know the scoop. And if you have any concerns or questions about it, you should come and ask me or Krista, get detailed information. So that's what it says. Health plan members who provide documentation will be renewed to the point where we think they can get coverage. Okay, I just mentioned this, but in order to be enrolled on the marketplace in an exchange plan, on January 1st, 2014, which is the start date for all coverage, one of the reasons not to feel like, oh my God, I have to do this on October 1st is because really you have a little time. If you enroll on October 2nd or you enroll on December 10th, you're still gonna get that January 1st coverage date. So people have time to compare plans. Nobody has to feel like they need to do it that day. But afterwards, after that, if you enroll in the second half of the month, your enrollment's gonna be 2 months out. So it's not an instantaneous process, and it's not like currently with Medicaid where you can apply retroactively. This is prospective. January 1st, 2014, you heard a lot about the essential benefits. And also starting January 1st, for current Medicaid enrollees, because remember, expansion's not happening till the springtime, the state will be using a federally mandated system called MAGI rules, which are adjusted gross income, is what that refers to. And Krista's going to go into some detail about that, so I will not. But the other thing is that most enrollees will no longer have an asset test. On March 31st, enrollment on the exchange ends. Then it's closed, right? Unless you have one of those qualifying events. And the unfortunate thing is that it will be at least April 1st before Medicaid opens. So you see there's a mismatch there. There's nothing we could do about that. So it is what it is. The good news is, though, that once Medicaid opens, it's going to be open year-round. So people will be able, unlike the exchanges, which are, they were set up, as Marianne said, to mimic employer insurance. I know every fall the county has an open enrollment period for employees to choose different insurances. It's the same setup.
Will that be retroactive?
Will what be retroactive?
New Medicaid expansion, will it be retroactive 3 months like when you signed up Medicaid?
Not before April 1st. Krista I don't know the answer, but Krista might. Will, after April 1st, for Medicaid, there won't be any retroactive coverage, or there will?
Oh, I don't think we really
No?
know that.
Okay.
We don't know.
Okay.
So whether like the new Medicaid expansion population?
Right.
Yeah.
I've heard neither yes nor no.
So stay posted. There's actually, this is, the Medicaid expansion piece is fast changing. So fast changing that during lunch I got an email that documented what Michigan Department of Community Health was telling the Michigan Health Plans yesterday afternoon. And some of it, I gave it to Krista so she could incorporate it into her presentation. But yes. So, but we do know, so one of the things that came out of that is that we do know that the Medicaid expansion will not open before April 1st. They had thought potentially that it could be late March. That will not be the case. So, and then start, yes?
I just wanted to add too, because I talked to Caleb Bukes yesterday from the Michigan Insurance Office. Is that anyone eligible for the Medicaid expansion who does not purchase health insurance in January and April when the exchange opens will not be penalized by the
Right,
government.
that's right. They will not be penalized because during that time period, we're considered to be a state where Medicaid didn't expand. And we're going to go over the exclusions in a second. And then, so then I said there's going to be another open market period. So one thing you have to tell people is like, yeah, this year you can dilly-dally, but next year you're only going to have like 8 weeks to decide. And so for some people, let's say that, you choose your plan and you're happy with it, it's basically going to be like sort of a reaffirmation, yeah, this looks good. If you have major changes in income though, you might be eligible for a lot more or a lot less. What if you didn't really like your coverage? You figured out this bronze coverage is not good, So for some people, it will require a fair amount of attention. I think you've got another slide from Marianne on this, but there is a penalty assessed on people who don't have health coverage for more than 3 months in a year. As Michael just said, those 3 months, January, February, March, that we don't have Medicaid, those are excluded from that. However, if someone then didn't get coverage till September, that would count. I believe they're just total months. And the amount goes up every year, right? So that's the time to help people get with the program. Yeah, it wasn't this much this year, but next year it'll be more.
If you lose your job in the middle of the year and may or may not qualify for unemployment, what happens to your,
Well, you'll very likely be eligible for Medicaid at that point.
so then
You can drop your coverage on the marketplace and get Medicaid.
drop it at any point? You're
Yes.
not obligated to.
No, you can drop it, and if you have that's considered a qualifying event, losing a job in any case, I think, so. Well, losing a job with health coverage, if you lose a job that doesn't have health coverage, but your income changes dramatically, then you can also call into the marketplace. Let's say you were making $20,000 a year, and then you get this great new job, and now you're getting $50,000 a year, and you estimated on the marketplace that you'd be making $20,000. You can adjust that. You can call in and make an adjustment. Who is exempt from paying tax penalties? What they call unauthorized immigrants. That's a lot of us would call undocumented immigrants. Indian tribes, financial hardship, that's that 9.5%. If you're uninsured for less than 3 months, or if you're uninsured, if you're eligible for Medicaid and you're in a state that doesn't cover Medicaid, and if you don't pay Social Security for religious reasons. Well, who is excluded from the subsidized exchanges? Like, what if you want to buy on the subsidized exchanges? Can you? Again, unauthorized immigrants cannot buy on the subsidized exchanges. And individuals and families whose income is under 100% of the poverty level cannot buy on the subsidized exchanges, even if they want to, but there is an exception for that. Individuals who are below 100% of the poverty level and who can't get Medicaid because of their immigration status can purchase exchange coverage and get tax credits. An example of that, and don't immediately run to the conclusion that we're talking about undocumented or unauthorized immigrants. We're not. We're talking about the person who has a green card and has been in the country for 2 years, okay? That's who your mind should go to. They haven't been in the country for 5 years, so they're not eligible for, they haven't had a green card for 5 years, so they're not eligible for Medicaid. They could still purchase on the exchange. Who's excluded from Medicaid expansion? Immigrants who aren't U.S. citizens or don't have permanent residency for at least 5 years. Adults whose income's over 138% of the poverty level. But remember, pregnant women and children through age 18 are eligible for, this says Medicaid, but it's really Medicaid or CHIP, my child, up to 200% of the poverty level. And that is true today. So in fact, the Washtenaw Health Plan just got a grant from the Center for Medicare and Medicaid Services that's focused on children who don't currently have insurance, but they're eligible. Let's talk about assets. Before, someone in this, we see a lot of people like this, and I'm sure you do, who are recently unemployed. They're getting unemployment, but they do have some savings. They're not completely broke, okay? And today, they would not be eligible for Medicaid. But going forward, there won't be an asset test. Okay, this I think is really important because there's a lot of resistance to buying in, and part of it's the confusion that you already heard about, right? But there's another piece of it, which is that like people don't want to pay for something that they could get for free, right? So if they had the health plan before and all they're doing is they're paying for their prescriptions, but they're not paying copays, they're not paying deductibles. Well, they're also not getting, we wouldn't make it on that qualified coverage. We don't have all of those essential benefits. We don't have physical therapy. We don't have maternity care. You know, so people from other counties that have health plans, they don't even have inpatient coverage. They don't have very much specialist coverage. So really, you want to remind people, this is really key to me, remind people you're going to get better health coverage. There's mental health coverage. There's physical therapy. You get, covered preventive care. There are subsidies. The cost sharing reductions, really I advise you to go over Philip's slides. I think, they had some really good detail in them. Tax credits. And then what if you really get sick? And one of the reasons I think people will be influenced, this is just my personal opinion, to get coverage is that everybody knows somebody who had a catastrophic illness, was perfectly ill, and then something terrible happened. But this is your sales job. I mean, we really need people to buy in. Okay, now's a chance where you get to talk to your neighbors, because I know you're really tired of listening to people talk. Here's your scenario. I'm just going to give you a minute. This scenario number one, we've got a mom. She's got 3 kids. The kids are on Healthy Kids. That's our children's Medicaid program, right? The mom makes $37,000 a year gross income. She has no health coverage at her job, and she has $25,000 in an IRA. And let's assume that, just so we make this, Medicaid's already expanded, okay? Let's just make this simple. To figure this out, I suggest that you look at your income sheets and just talk to your neighbor for a minute about what you think this family with 3 kids should do. Okay. So, mom comes into your office. This is what you know about her, and what can you tell her based on what you know? What did you guys talk about? You didn't get very far.
We're referring her to the exchange.
Okay, why are you referring her to the exchange?
She's over 38%.
Okay, did everybody get that? Can you find on your yearly income thing? She's got $36,000 in income for a family of 4. That puts her, 37, sorry. That puts her between 35,000, which is 150%, and the 185 at 43, right? So, right, okay, so she's over 138% of the poverty line, so is she eligible for Medicaid? No. Is the $25,000 in an IRA, does that matter? No. Okay. She doesn't have health coverage at her job, so there's no issue of comparing affordability, right? So you're going to send her to the exchange. And what are you going to tell her about the exchange?
Qualify for tax and subsidy.
Will she qualify for both the cost sharing reduction and the, yes. Right. Okay, so you mostly have good news for her, right?
But why do the kids qualify for Medicaid if she's,
Because,
if she's?
and actually, I should have said my child there, because, but I should have said that they were on my child, because the CHIP, the Children's Health Insurance Programs, go up to 200% of the poverty level. And that's why if you look up here, you've got these, these different codes, that's why.
She goes to the health exchange, she's applying as a single,
Well, no. I mean, when she goes to the health exchange, that's a very good question. She's putting in, she's a single mom with 3 kids. She has a family size of 4. And actually, I'm really glad you asked that, because if the kids did not have any coverage, if we had the same scenario but nobody was covered, they would direct the mom to the subsidized exchanges and the kids to Medicaid. At least that's how we've been told it will work.
That's how it's going to work.
Yeah, I mean, we haven't seen it. So I'm glad you asked that question. She's making $37,000 a year. She's still paying for a family of 4. Just because the kids already have their health coverage, that doesn't, yes.
I just want to add one more thing too. Applying on the exchanges will not change the coverage you have. If you, some people are nervous to go, I'm on Medicaid, I don't want to change anything that I have. If you apply on the exchange, it will not change the coverage they have. You'll get more options, but it won't change your status. Same for unauthorized immigrants, they accidentally apply, people are nervous. They apply on the exchanges and they're not eligible for coverage, so they're denied. But they've already put out a policy pronouncement that will not be used to hunt them down or deport them. That will not change their status.
Okay, yes.
So I know that it's been said that if you go onto the exchange, and so you're completing this, and if you're going to be eligible for Medicaid, it would be there. Will that leaving happen on October 1st or not until?
So at this point, what we have from MDCH is that until April, it won't happen before January 1st, but starting January 1st, they'll only be assessing it for people who are currently eligible. So if these kids didn't have coverage, because they're currently eligible, if these kids didn't have coverage, they would be assessed. Does that make sense? If the kids did not have coverage, they would be assessed. But if an adult applied who will be eligible in April and they're not eligible in January, they'll be told they're not eligible.
Ruth, this might be a good time for me to, from
Yeah.
that email that Ellen sent to you that you had.
Yeah.
So, and none of this is final yet, so the whole Medicaid expansion piece is still completely evolving. And so what was in their email was that from So what the marketplace will not see, that we can all see with our own little eyes, is who's gonna get Medicaid expansion, which is a huge population, right? And then there was language in there that they're working with, not necessarily the marketplace, but HHS, whatever this means in reality, and it's not gonna trickle down and translate into anything probably much really helpful, but that they're gonna try to develop positive messaging regarding Medicaid expansion, because we're not a state that said no. So whatever kind of messaging they're giving for states that already said no, which is probably not good, they're trying to develop something else. So what that something else is, who knows? I mean, I don't think it's gonna be a big thing that's gonna come up and say, ooh, you might be eligible for Medicaid expansion, you know, come back later, or, you know what I'm saying? Like, I think it really behooves us to know this stuff.
Right.
And kind of think of the marketplace for Medicaid as it exists now.
Right.
Because I don't think it's gonna turn something out that's gonna say, oh, Jane, yeah, you're gonna get Medicaid expansion, you know, stop, don't go forward here, just wait till April, then you're gonna get a much better deal. It's just gonna say, if this were the scenario, mom, 3 kids, it would tell mom, there's nothing for you here, and your kids are eligible for Healthy Kids Medicaid. And right now, the portal that it refers you to, and like I said, we don't know what this is gonna look like in reality until October 1, right? But for right now, what it does is it takes you to the DHS website, to the MARS, and I'm not kidding when I say it takes you to Mars, that's an honest answer. It takes you to the MARS system, which does nothing but just sort of like tell you what you might be eligible for. So
Yeah, I think.
so for Medicaid people, I think we're really kind of probably best off using the Medicaid tools we already got in our toolkit, you know.
Yeah.
Well,
My concern is for, like, people that we have that are sharing care, that perhaps they don't qualify for Medicaid because they're an adult male, but their income level is low enough that we end up providing them with charity care, is that we don't know whether they should buy something on the exchange or, I mean, they'll need to talk to us.
they will need to,
go out.
yep, they'll want to talk to you,
I was
because
hoping they could go.
Yeah, no, so I think that's the important message. Do not, especially before Medicaid expands, and while so much is in flux, you need to bring your brain. Bring your brain to work with you when you're working with these people, and do your own assessment. And if you think they're currently eligible for Medicaid, help them apply through the correct Medicaid portal, the healthcareformichigan.com or the MyBridges, okay? But bring your brain, and that's why we're gonna discuss scenario number 2. In this scenario, and this is why you also may wanna bring your calculator to work, okay? In this scenario, we've got a family of 4, and unfortunately, both parents are currently unemployed. They're each getting $300 unemployment each week, and they worked for the same place. They got laid off at the same time. You might actually know people like this. I do. So their health insurance ended when they were laid off. Nobody has insurance now. I didn't say this, but their kids are minors. The parents have a house, 2 cars, and $100,000 in a retirement account. Okay, so talk amongst yourselves. Think about that. Think about that. Think about asset testing. And maybe think about asset testing. Well, oh, right, we're doing this today. I got confused myself. And we're thinking about this for May. This happened in May, okay? So we're beyond, Medicaid has expanded. Okay. Okay. All right. And we'll be taking a break in about 10 minutes. So anybody want to volunteer their thoughts? Well, Krista will. How about somebody besides Krista? Okay, Erin says they're all eligible for Medicaid. Can you defend your answer?
Well, they make $2,400 a month for family for the 138% would be $2,700, and they're under that. So.
Okay, do you guys see that? That they're at, okay. Okay, so they're under that, so, and nobody has, and there's no asset test. And so they should be eligible for Medicaid, right?
But
Yeah.
I think we should point out too, so if this were a family though, let's just say it were now.
Well, and that was the second question. Caitlin said, could we look at what if it were now?
Sorry.
No, go ahead. What would you say? What if it were December? That was her.
Right, so for now, they would certainly, parents would not be eligible for Medicaid. I mean, they would get a Medicaid spend down, it would be really high, no one would ever use it, because now it's processed by DHS, so, my daughter. So they would, however, be eligible to purchase on the exchange, and because they're under 250% coverage, they would get premium tax credits and the cost sharing, and then we would definitely say, wow, it looks like the solar plans Russ wants to do, without steering,
Right, and then in May, if they were still unemployed, they could drop that coverage, or April, they could drop that coverage for Medicaid.
And so this was one of the issues brought up in that email, is that, so that they are mindful of the fact that there are gonna be these people between 100 and 138% of poverty who do go on the exchange and do purchase insurance and then become eligible for Medicaid. We don't have an answer, but MDCH is at least exploring the fact that this needs some kind of a resolution or an answer. So at least it's on the table. It's on the table. I can't tell you if anything will be like sort of an automatic thing. I would suspect probably not, or whether any kind of notice would go out. Maybe that would be, in fact, that MDCH would have the information to send a notice. I really have no clue as to how the question will be resolved, but at least that question is exactly on the table.
And at least your answer to the family can be, you can get this now, and if your situation stays the same, which maybe they'll find jobs, then you can get that later. Yeah.
So she mentioned spend downs.
Yeah.
Under the new system, that's going to be.
Krista will talk about spend downs later. I think it's a little confusing. I don't want to get into it right now, but Erin?
So, just to add to the complications, but this family is currently on the health plan, so the adult parents, currently on the health plan, are they a family, like, they would be ineligible as of 12/31? So they would kind of, if they want that gap, if we got coverage, they would have to buy it from the exchange.
Is that,
What's the question?
do you want to answer that,
If they're
Krista?
currently on the health plan, on Plan B, would they be off as of 12/31?
Well, everyone's coming off.
Right, no, I know, but would they,
Right, like,
you know,
you're saying, let's say they walked in, and they say, oh my gosh, can you help us? They are exchange eligible.
right,
So we help them into the exchange, and then tell them, you can get to Medicaid in April, straight away.
right, no, I know. I'm
Right,
just
no, you're asking
clarifying
about that because we do, yeah.
That this is a scenario where the person would not be eligible for the health plan in between 12/31 and when Medicaid opens?
Yes,
Okay,
yeah,
so if they want coverage, it would be to the exchange for
yes,
that period.
right. And, but I want to remind you that if you look back at Philip's slide on the premiums and cost sharing, it does slide down to 2%, so. Okay, next scenario, family of 4, 2 adults, 2 kids. The youngest child has a developmental disability, gets children's special health care, Medicaid's the secondary. The family's combined income is $46,000, that's a year. Dad's insurance cost effective January 1st is $100 for an individual, but $600 if he wants to insure the whole family. And the family's been paying for health care through their employer, should they still? So you don't have to necessarily have the definitive answer. Remember, we don't have the plans in front of us, but you still have to be able to think about what you would tell them. Okay, what are you thinking about? What things should we be taking into consideration for this family? Okay, they're paying, right, so you're thinking if you use $600 a month, that's above the affordability, right? So I'm glad you brought that up, because I wanted to make sure that people are clear that affordability in the exchanges looks